Hello, my name is Chris Miley, Solutions Consultant with McKesson. I will demonstrate to you how to quickly and efficiently document an exam for a patient, Gus Worthon, who is complaining of heel pain. We can see on the provider dashboard that the patient is ready to be seen by the doctor in room 1. We'll access the chart, and from the chart we can access various specific chart sections such as the problem list, medications and allergies, vital signs, and any orders that may be pending still. We begin to access a note where we select a template, and we can see here all of our podiatry templates brand new to our McKesson customers. I'm going to scroll down and select the one for plantar fasciitis. We can see the system inserting information into our single screen template, such as the date of birth, vital signs, medications, and allergies. We'll begin to document our note from top to bottom. And just like your paper forms today, you move from top to bottom, documenting left to right. And in doing so, by using our template, we hope that we have replicated what you're currently doing today, thus easing the transition from a paper-based environment to an EMR environment. You can see I have the various items I can choose from my list, which will be modified on the fly and easily by the provider. We'll go ahead and document associated symptoms by indicating negative weakness with weight bearing or walking activity, presence of morning stiffness. The remaining symptoms are negative. We'll complete our review of systems. It will indicate a full negative review of systems except the presence of the foot pain as documented by the patient. On that form, the patient indicated that the right foot was swollen and tender and would be described as moderately tender by the patient. Areas we can skip, such as the breast, since this is a male patient. And anything that I do skip is grayed out, including entire lines. Anything that is gray is simply going to delete itself from the note. When it comes down to tenderness to palpation, we'll indicate that tenderness is felt on the calcaneus, the insertion, and along the medial band. Range of motion is negative. And strength will indicate that the dorsiflexion is 2 of 5, plantar flexion is normal. Patient has a moderate ontologic gait. We'll diagnose an assessment of plantar fasciitis or prescribe naproxen, and will indicate that we use our e-prescribing module. The e-prescribing module is going to insert our G code, which is going to be added to the claim. And carriers who do provide e-prescribing incentives, they will note that G code, and that is how they are made aware that you are using a documented, qualified e-prescribing system. We are also going to order a foot x-ray of the right foot, and we'll have that order sent to the nurse. Down below, we'll discuss patient education with the patient and various exercises they can do to help alleviate some of the pain and strengthen some of the muscles in that area. We'll give the patient an injection of dexamethasone, 1 milligram, and you can see how that one click inserts 2 separate CPT codes. Also, we're going to separately document the procedure itself. For this injection, it will indicate that the injection was given on the right. You can add comments on the fly, whether by writing, typing, and when I say writing, I mean handwriting recognition on a tablet PC. Will indicate that the area is prepped in a sterile fashion and the plantar fascial injection was given without any complications. We'll have the patient follow up in 1 month. And before he leaves, we'll go ahead and print out patient education regarding plantar fasciitis We can also help to describe this image or allow the patient to describe the pain to us in this image to kind of confirm the area of pain. All of our patient education comes in both English and Spanish. In our templates, we do include notations on various articles and documents regarding best practices and the references that we use when designing these templates. At this time, we'll go ahead and save the note, and we will see where the system is recommending a 99214 for this established patient. If this were a new patient, you can see how it can quickly update that code. It is only a recommendation. You do have the option to accept, modify, or reject that recommendation, and the note is completed. Here we have the application of a protocol specific to this medication. Your final note is going to appear just like this. And I will scroll to the bottom. So that you can see the documentation of the assessment, the procedure code for the e-prescribing of naproxen, the order for the foot x-ray, the procedure codes for the injection, documentation of the injection, the action item for the patient to follow up in 1 month, and the recommended procedure code for this new patient 99202. McKesson's proprietary BrightNote technology disseminates information from that note to the rest of the chart, keeping your chart relevant and up to date, such as a current problem list, procedure list, orders, a pending X foot ray, and also an electronic encounter form is created where your checkout staff has acknowledgement and review of that action item, capture of all the charges, the G code for the e-prescribing, the 2 diagnosis codes, the 2 procedure codes for your injection, the single E&M code, the single diagnosis code, the action item. Again, your checkout staff will see that. And lastly, your medical assistant, your nurse, or your x-ray tech is also receiving this order. This concludes the demonstration. For additional information, please contact your sales representative. Thank you.